Hello everyone, welcome back to my video. In this video, I am going to talk to you about breast care. Myself, Gideani Thomas, working as a nursing tutor in Tripoli College of Nursing. What are the objectives of this video? At the end of the session, you will be able to describe the anatomy and physiology of the breast, define breast care, list down the purposes of breast care, enlist the contraindication and explain the procedure of breast care. These are the objectives of this video. The breast are the large modified sebaceous gland and it is located on the anterior chest wall between the second and third ribs superiorly, the sixth and seventh costal cartilages inferiorly, and the anterior axillary line laterally and the sternal border medially. The size and shape of the breast vary at different ages influenced by heredity, hormones and nutrition. We will see the anatomy and physiology of the breast. The external surface of the breast, it is divided into three portions. First is the smooth and soft area of the skin extending from the circumference of the gland to the areola. The second is the areola. It is a heavy pigmented area of the skin surrounding the nipple that varies from pink to dark brown and may change during pregnancy. The third is the nipple. Nipple is a largely composed of sensitive erectile tissue and form a large conic papilla projecting from the center of the areola. Its summit is at the opening of the milk duct. There are 3 to 20 milk duct openings. Small papillae called Montgomery glands. Roughen the surface of the nipple and areola darken during pregnancy. The function of the breast are to provide nourishment and protective maternal antibodies to infant through the process of lactation. Internally, the breasts are made up of glandular tissue and fat. Each organ is divided into 50 to 20 lobes, separated from each other by fibrous and 40 walls. Each lobe is subdivided into many lobules which contain numerous acini cells. The acini cells are composed of a single layer of epithelium beneath which is a small amount of connective tissue richly supplied with capillaries. The internal mammary and intercostal arteries supply the breast glands and the mammary veins flow these arteries. Many cutaneous veins become dilated during lactation. The lymphatic are abundant towards axilla. These breast glands are present in the male but exist only in the rudimentary state. Nerves abundantly supply the breast which contain tissue that respond to hormones. Estrogen hormones stimulate the growth and development of the ductal epithelium. Progesterone in combination with estrogen is responsible for acinar and lobular development during the luteal phase of menstruation. What is the definition of breast care? Breast care, it is defined as a procedure performed to clean the breast of the mother during pregnancy and lactation in order to maintain hygiene, prepare breast tissue and nipple for breastfeeding and prevent spread of infection to the baby. This is the definition. So breast care, it is the procedure performed to clean the breast during lactation and pregnancy to maintain hygiene, prepare the breast tissue and nipple for breastfeeding and prevent infection. What are the purposes of breast care? There are many purposes for breast care. Preparing for breastfeeding, promotion of lactation, prevention of breast infection, prevention of injury to the nipple, maintaining breast hygiene, promotion of circulation and comfort, promote sense of well-being, stimulate milk ejection, detecting any breast abnormalities. These are the purposes of breast care. What are the indications and contraindication of breast care? The indications of the breast care are nipple with unhygienic condition. Some mothers, they are not cleaning the breast during the pregnancy and lactation. So, in the mother with the unhygienic condition and crack or sore nipple before initiating breastfeeding. So it is very important, otherwise the baby will affect some type of infection. There is no contraindication for breast care. What are the principles of breast care? There are three main principles. First one is clean to unclean. Second one is far to near, and third one is circular motion. These are the three main important principles for breast care. These are the equipments we have to use for the breast care. Screen it is needed for the privacy of the mother. Macintosh with the throw sheet that we have to keep under mother's chest. Mitten 2, because each breast we are using one mitten. And small towel to cover the breast. Bowl with the cotton swab. Cotton swab is using to squeeze the nipple. Bowl with the hot water for cleaning. Jug with the hot water, and kidney tray or paper bag to discard the waste. The procedure of breast care. Now, first we have to prepare the mother, and then we have to explain the procedure to the mother. Place the mother in a supine position in the bed and place the Macintosh and throw sheet under the mother's chest and expose the breast and drape with the towel and wash hands. This is a pre-procedure. And procedure. First we have to do the assessment of the breast. In the assessment, first one is the inspection. For the inspection, expose both the breast and observe for the symmetrical expression of breast while moving arms and tightening the pectoral muscles. That is the inspection. In the inspection, the breast we have to see for the size, symmetry, contour, mass, dimpling, flattening. This we have to see. And then inspect the skin for the color, thickening, edema, venous pattern. And then we have to see the nipple, size of the nipple, shape of the nipple, and we have to see it is inverted, cracked, retracted, or any ulceration there, any discharge, that we have to assess in the nipple. After the inspection, we have to go for palpation. In the palpation, palpate from center to periphery by using the parts of the fingers in circular motion, and we have to end with the axilla. Assess for any excess warmth, tenderness, pain, mass, nodules, lymph node enlargement. Squeeze the breast to observe for patency and secretion. Pinch test to check the nipple. Position the thumb and forefingers on the areola about 2 to 3 cm behind the nipple. Pinch the fingers together. Now see the nipple for. If the nipple is stand out, it is a normal nipple. If the nipple stays flat, it is a flat nipple. And if the nipple pulls inward, it is a inverted nipple. This is a procedure, step by step procedure, how we have to do. First is to check the temperature of the water and pour the water into bowl for cleaning the breast. And then clean the nipple first and areola with a wet gauze in circular motion in the following order. first is nipple and then primary areola and then is the secondary areola. So before I told you that farthest to the nearest, that is a principle. So in the furthest breast, first we are doing the cleaning. In that we have to go for anti-clockwise direction. And using the wet cloth in circular motion, clean the total breast, lower Cs and the axilla. Then tie the breast with a clean towel and cover the farthest breast and expose the near one. So while doing the near breast, we have to do in a clockwise direction. That is a procedure. After the procedure, what we have to do? We have to redress the mother, make the mother comfortable, encourage the mother to feed the baby. Then we have to replace all the articles and wash hands, and documentation, it is must. Record the procedure and any abnormal finding, if you find out, you have to tell to the doctor. So it is important for further planning of the care. In this video, we've seen that what is breast care. Breast care is a guide to the health profession to diagnose and manage the common health problems. Breasts are very vulnerable and fragile part of woman's body. During pregnancy and lactation, because of various hormonal changes in the body, breasts to undergo a number of changes. Therefore, it is important to take special care of them during this period. Need of breast care for all lactating mothers is most necessary as this directly link health of the mother and the baby. Good breast care improves health of breast and in turn breastfeeding for the mother and the baby. This is all about the breast care. I hope you understand what is breast care and how you have to do the breast care. Thank you for watching this video.